Hi, it's Dr. Dave Candy, and welcome to our weekly Friday Fix. We're in November, and so the holidays are rolling right around. There's going to be a lot of holiday travel going to and from destinations. And in the past, we've done videos on how to drive more comfortably without neck and shoulder pain. If you check back in our blog, you can find those. But today, what we're going to be talking about is how to get in and out of the car without back or hip pain. A lot of people who are having back pain or hip pain, they have trouble lifting their leg to get in or out of the car, or getting from a seated position to a standing position. Whether they're in a chair or getting in or out of the car, they have trouble with that. And so that you can travel more comfortably around the area when you're doing your holiday shopping this year, and get in and out of your car when you're traveling to family destinations for the holidays. We want to show you some tips that you can use to make getting in or out of the car more comfortable, even if you do have a back problem or a hip problem. So number one is that you want to avoid twisting with your low back, that your low back really wasn't designed to twist well. So when you are getting in or out of the car, what you don't want to do is just step out like that, where your spine stays stationary and your hips twist. The best thing to do for a back problem, so that you avoid twisting, is to lift one leg out of the car, bring the other leg around, square yourself up and scoot to the edge of your seat. Then, just like we've done with sitting, getting out of a chair in the past, you want to lean your body weight forward. And as you lean forward, your weight's going to naturally load on your feet and come off of your bottom. The closer you can get your feet to the edge of the car, the closer it brings them to your center of gravity, and the less far over you're going to have to lean. So you want to start out by leaning really far forward, getting your nose and your head out forward, and actually bringing them down. Because when you bring your nose and your head and your shoulders down, it actually lifts your tail up. So you start by leaning forward, bringing your head and shoulders down, not up, even though up is the destination, and that lifts your hips up. Then you just roll your pelvis underneath of you, and you come back up to a standing position. Sitting back down is just the opposite of that. You start by tucking your head and shoulders, sticking your tail backwards, hitting the seat, coming back up, watching your head on the door frame, and coming in. Then stepping up with one leg, lifting the other one in, lifting with your hands, and pivoting yourself in the car. So again, to review, getting out with a back problem, to avoid twisting, lift one leg, set it outside. Bring the other leg around, lift that one, set it outside, so that you try to remain in as neutral of a rotation with your upper body to your lower body as possible. Then slide yourself out of the car so that your butt's right on the edge, your feet are as close to you as possible. Lean forward and tuck your head and shoulders down. That lifts your tail up. Then just roll your pelvis underneath of you to come up to a standing position. Going back down is just the opposite. Head down, hips back. Watch your head coming in, pivot back in. Now with a hip problem, particularly if you have a hip flexor problem, or if you've got some arthritis in your hip, or if you have hip bursitis, lifting your leg, just the process of doing that to get in and out of the car, can actually be painful. If you use your hand to help it out, actually lift it up using the weight of your hands, so that you don't have to use your hip muscles, that your arms do most of the work. Swing it out using your hands and set it on the ground. Bring the other one out along with it, and then the process for getting up is just the same. Getting in the car, it's the same exact way, you just go in reverse. So you lift one leg in, assuming this is the good leg, and then bring the sore leg in. If the leg that's closest to the inside of the car is the one you have the problem with, you just lift the other leg. So bring that one out, slide this one over, lean out a little bit, and lift it with your hands, set it down, head and shoulders forward, roll the pelvis under. So I hope that makes your holiday travel more comfortable this holiday season. If you do have any specific questions about your back problem or your shoulder problem, give us a call at Movement for Life, or click on one of the links below and you can find some useful information that you can use, or a way to get in touch with us. Have a happy Friday.